In the post 9/11 environment, police, fire, and EMS and all first responders are finding themselves exposed to the same threat that the military sees daily, and that's the threat of penetrating gunshot injuries and blasts, particularly to the chest. The most effective way to treat penetrating chest injury is by sealing the chest off, and the most effective tool out there available to us is the Halo Chest Seal. The chest seal has been an evolutionary process, and one of the biggest problems has been with getting a seal that is effective in any environment. And the Halo Chest Seal has established itself as one that's going to stick no matter what, and that's what a critical component is. In addition, the Halo Chest Seal comes with 2 chest seals to cover both the front and the back of the patient. We'd now like to demonstrate the Halo Chest Seal.
As you approach a patient that has an obvious penetrating chest injury, if possible, take some 4x4 gauze to wipe around the area affected. If you don't have 4x4 gauze, it's no problem because the dressing will adhere without any problem at all. Remove the Halo dressing from its packaging. It comes with 2 in each package to ensure that you have enough for an entrance wound and potentially an exit wound as well. Remove it from its packaging. You're going to apply direct pressure directly over the site to ensure that you have a completely occlusive seal. During your ongoing assessment of the patient, if the patient develops a tension pneumothorax, the Halo seal comes with an easy pull tab that you can simply just pull back the dressing to burp the wound and can easily be reapplied by simply just applying that direct pressure to create that occlusive seal. Once we've completed the application of the initial Halo dressing, we're going to check the back to make sure that there is no exit wound. And for this, we'll remove the second Halo seal from its packaging if there is indeed an exit wound, and we'll apply it in the same steps that we did, taking care of the initial entrance wound with the Halo dressing. And at this point, we're going to continue to monitor the patient to make sure that there is no development of a tension pneumothorax. For larger exit wounds or larger traumatic injuries to the chest, larger than the initial Halo seal, you can apply a Halo XL dressing, which is 40% larger and has twice the adhesion. And you would apply it in the same manner that you would your initial Halo dressing.
Halo chest seals are utilized to cover penetrating chest wounds such as gunshot entrance and exit wounds. Halo also prevents the air from escaping or entering the thoracic cavity. The Halo seal can also be used to cover and keep other gauze bandages in place. The Halo was designed to work on patients with heavy perspiration or in very wet environments. The highly aggressive tack adhesive of the hydrogel will enable the dressing to conform and hold to the patient's body. In summary, the Halo Chest Seal is the essential choice for managing penetrating chest trauma. It is ideal for the treatment of open pneumothorax and also to prevent the development of a tension pneumothorax resulting from gunshots, stab wounds, or other penetrating chest injuries. So when dealing with penetrating chest wounds and when time is critical, the first step to saving a life is to use the Halo Chest Seal.
With the Halo seals, these are used for any deep penetrating trauma on the chest or the torso area. What we are worried about is either a possible tension pneumothorax or an open pneumothorax. And so we want to make sure we limit the amount of air that is possibly getting into this wound. As a good rule of thumb, any deep penetrating trauma between the neck and the navel, we should be putting on some kind of occlusive dressing like this Halo seal. Whether it be from a gunshot wound, a stabbing, or even a car accident, any deep penetrating trauma between the neck and the navel, we want to put some kind of occlusive dressing on. If after time it looks like the patient may be developing a tension pneumothorax, just like they mentioned in the video, we can pull back this dressing and actually burp some of the air out of that wound to relieve that pressure and then reapply it. Remember, the Halo Seal is used for any deep penetrating trauma between the neck and the navel, and it's used to stop any air from getting into that chest cavity. This will stick to wet, sweaty, bloody skin. It can be removed and reapplied very, very easily, and it can be folded or rolled for storage in the vest or your medical kit without degrading the material whatsoever.